Hi, this is Stephanie Stott from Ohio Advocates for Medical Freedom. Today we have the pleasure of having Kevin Berry with us. Kevin is a lawyer and author of the book, Vaccine Whistleblower. He's the parent of a vaccine-injured child and the current president of First Freedoms. First Freedoms is a nonprofit organization formed to address the right of freedom of health choice, religious freedom, and other freedoms guaranteed by the First Amendment to the Constitution. The interview will be split into two segments. In the first segment, we're going to start by discussing Kevin's background and the new changes to the Department of Health and Human Services. Kevin, would you explain a little bit about what you do and what your organization is about?
Sure. Thanks, Steph. First Freedoms, as you said, it's the first freedom listed in the First Amendment, the Bill of Rights, is freedom of religion. So that's a central thing that we're supporting. Other freedoms are, and so the tagline for First Freedoms is religious freedom, civil rights, human rights. So the way it applies to vaccine freedom and choices on vaccine is you have a religious freedom to opt out, you have a civil right to attend public school, and you have a human right to informed consent. So all of those things are in play when states try to take away parental rights for their children. And we are pushing back against that around the world.
Great. Before we get into the new division and the proposed rule, one of our members wanted to ask you a specific question. In terms of HHS authority, Healthy People 2020 and advisory committees, does HHS have the legal authority to develop and implement arbitrary goals that violate basic medical principles and civil rights without clearance from the Justice Department?
Well, again, this is where everything gets very murky. We'll get further into like the new HHS proposed rules, but what's important about what recently came out, and I'm going to answer the question as directly as I can, but the simple answer is it's hard to tell. You don't know what the future holds, but it's very promising that the recent HHS proposed rules discuss vaccination. They mentioned it 10 times. And it's almost the first time I've seen the federal government have an adult conversation about vaccination, where they're going into the subject more than the slogan of vaccines save lives. And what's important, another thing that's very important about that is an HHS proposed rule, is that Health and Human Services is the parent agency of the three major health divisions of the federal government. So HHS is the parent org of the CDC, of the NIH, and the FDA. So a proposed rule coming from HHS is a broad swath, and I think it's very positive and a lot of us have worked for a long time to see the federal government take an active interest in vaccine safety, and I've been at it since 2000, and this is the first time I've seen anything like this from the federal government. So it's a positive thing. Now, broad initiatives like Healthy People 2020, a lot of that's like sloganeering, and they set goals, and of course, like every goal is arbitrary, and and what the Department of Justice is going to do, that's another cabinet level. HHS Secretary is a cabinet level position. Department of Justice is a cabinet level position. So whether Jeff Sessions, the current Attorney General, has ever heard of Healthy People 2020, my guess is no. So what interest might the current Attorney General or other Attorney Generals of the Justice Department take in how Health and Human Services applies its regulations? It's really impossible to know. So I'd say from an authority standpoint, the federal government has ways to influence policies in states, and one of the main ways they can do that is with budgets. So
money,
right? So that we'll have to see how these rules go. This current one is targeted at the health sector, and whether rules for the health sector are going to dribble over to the lawyers and U.S. attorneys' offices, whether it's going to dribble over to the Department of Education, it's hard to tell. We hope so. The principles are clear. The principles in the HHS about the importance of religious freedom and respecting religious freedom. If that's the principles that this administration want to put forward, why would they only do it for HHS and not for justice and health? So I think it's a very promising sign, but it's too soon to tell.
Okay. There are two recent big news items impacting informed consent and medical freedom from HHS. Do you want to explain specifically the new division and the proposed rule?
Yeah, the new division is it's emphasizing religious freedom. It's to me, it's always been a little bit puzzling, that like religion and science have to be separate things, as if people who are scientists or who have science backgrounds don't also have faith. So like, it's not, to me, it's not, it's not an either or, but it's been treated that way, I think, for a long time.
Yeah.
So I think that it is just very positive, as I said earlier, that HHS is recognizing that religious freedom is a fundamental American trait, and they're saying that healthcare workers, if they have religious objections to procedures that they're asked to do in the course of their jobs, or procedures they're asked to participate in the course of their jobs, that they don't have to, which is a right of being an American. It's right. It's a civil right and a religious freedom.
Yeah, absolutely. What do you think the new division could mean for workers who have been fired for declining influenza vaccination, or do you think it would possibly apply?
Yeah, I think we have to see how the proposed rules played out. It's still proposed rules. Like I think it was a 60-day comment period. We're probably 15, 20 days into it. But for the people already fired, I would hope the administrators would do the right thing and bring them back if they want to come back. And this is again where it gets murky. Because if someone currently gets fired for their job for uh, uh, for asserting a religious belief, and their employer says no, then they have already an Equal Employment Opportunity Commission
Right.
right to complain about it. But going through that process can take years. It can take 2 or 3 years. So like how it works on the ground, how it works practically for workers, it's like if you don't have a way to feed yourself for 2 or 3 years, it puts a lot of pressure on you. That you get your job reinstated 3 years after. And this happened, and we've discussed this before, you and I. There was a case in Pennsylvania where it took 2 or 3 years, but the workers were all reinstated. They were reinstated with back pay. But in order to go through that process, you have to have a way to sustain yourself.
Right.
And so, like, what the law is and what happens in the real world is frequently different. So, what another very positive thing, should these proposed rules go through for healthcare workers, if you're looking in the middle of the proposed rules, and there's about 30 or 40 pages, I think, the proposed rules, they list all the places that have to post prominently the notice, and it's a notice that the religious freedom will be respected, and it's every form. They went through a thesaurus and found every possible way to say every single healthcare provider that receives federal money. I think they list 38 different types of places, and it was something like they're estimating 600,000 places would have to post the notice. So if this goes through, it will change what happens going forward in hospitals and healthcare workers. How it would affect people looking backwards who've already lost their positions is hard to say, but hopefully the hospitals will learn, if the hospitals would learn, that the right move would be to bring the people back. Because they've punished people based on a policy that's a federal policy that's no longer a federal policy.
Right. Now, what about those that are on a religious exemption that are being forced to wear a mask, but say, like in Ohio, ONA nurses can be exempt, can get an exemption, but they don't have to wear a mask. You could say that's discrimination based on, you having a religious belief that you have an exemption for. So, what about masking policies? Could that potentially be a discrimination issue as well?
It
I
could,
mean, as
but
far as religious,
it's obviously a much lesser thing. Like
right?
being terminated versus wearing a mask. This is where it gets into a weird rights thing too, because you're not necessarily entitled to work in a healthcare facility. So if the healthcare facility's policy is that you have to wear masks, that you can complain about it. But if you're going to leave your job, if you're going to quit your job over that, that might be a tough case to bring. That was a big enough violation of your rights that
Right.
you're bringing a case as opposed to being terminated, which is an obvious bigger issue.
Right. I totally know what you're saying. What I'm talking about is specifically hospitals that have a policy where if you're not vaccinated on a regular religious exemption, you have to wear a mask. But if you're not vaccinated on an exemption, as a religious exemption, as an ONA, union nurse, you don't have to wear a mask. So you have two religious exemptions side by side. One is masked requirement, one is not. That would be the one that I would be talking about, like it being discriminatory. Yes, if they have a masking policy across the board, you'd have to follow it.
Right. Yeah. And of course, and that just that shows how the
How
hospitals.
much it's about public health, right?
Yeah. It's if the union nurses who have a bargaining collective, they can get a better deal than the non-union nurses, then it's perhaps it does expose that it's more about moving product than health. And let me just throw one other thing on that, because like everyone's running businesses, right? And that every form of healthcare is a business. So when a hospital administrator, like if they have 500 employees and if they buy 500 flu doses, they get a 20% discount, or if they buy 300, they get an X discount. Like whatever, the more they buy, the lower bulk discount they get. That's not health.
No.
That's bean counting. And but for the administrator standpoint, if they buy 500 doses and then they have to throw 200 of them away, now they've done a bad budgetary thing. Now they get dinged by their bosses. Why did you buy these doses? So if they buy the doses to get the best price and then they're stuck with them because the people don't want them, now they've made a bad business decision. So rather than make a bad business decision, they're forcing people to take it under their skin, which is theoretically an absurdity. And I think the federal government is waking up to that. That hospitals and doctors' offices, and I have had this conversation a million years ago when Generation Rescue first started. It was me, J.B. Hanley, and his wife, and we got, it was in 2005. We got a booth at the American Academy of Pediatrics.
That was a good time.
in DC, because they didn't know what Generation was yet. It was just a website. I don't think we could do that now. But it was really interesting talking to the pediatricians because they were, at the time, thimerosal was a big issue, and they were buying mercury-free flu shots and holding them back for people who asked for them, and they were slightly more expensive. So they were talking business to business, and they were buying, if they had say 200 kids in their practice, they buy 180 regular doses and 20 thimerosal doses and they'd hold them back, and they wouldn't give them to them if it was unless they asked for it. And then at the end of the year, if they had 10 of those, they had to get rid of them. If they didn't use all their more expensive ones, it expires after a year, right? So then the vaccine manufacturer's not taking it back, so the doctor's eating the loss, right? So they don't want that. So I would suggest to them, why don't you just poll your people, right? Don't order more doses than you want. Ask your parents. Like the 3 Barry boys, guess what? They're not getting a flu shot ever, right? So don't order one for us. But I don't want to stick you with the cost of that. So let's have an adult conversation.
Right. Or maybe if they're going to bother ordering the thimerosal free, they can actually give it to all of their pregnant employees instead.
Yeah.
Having to ask them, since that would be the appropriate thing to do with a pregnant woman, since they're not allowed to eat tuna. But that's another conversation.
Yeah, and why there's on the market a safer version and a less safe version makes no sense. If there's a safer version, take the other version off.
Right. Yeah. Well, there's that too.
Again, an adult conversation. This is the headline of the HHS thing. This is the federal government beginning an adult conversation.
Yeah, absolutely. Recently, we've been informed that people forced to wear masks for declining the flu shot have been instructed they can no longer tell patients and others why they're wearing a mask, or they have to provide a company-provided answer. Would this be grounds for a complaint? I mean, I think what we know is the hospitals realize that they're basically violating the employees' rights and they don't want it advertised. That's how I'm taking this.
Yeah, but I think that's, again, a complicated thing. And it could be a complaint, but is it enough? What are your damages? What are you going to do?
Right.
Like if you're fired, you have a clear case for damages. If you're not allowed to discuss your opinion on flu shot efficacy why do you have a right to do that? So to me, wearing the mask is saying that your opinion is being broadcast. I think people in the public know if a nurse is wearing a mask, it's actually refused the vaccine. I think people will know that over time. Maybe you can
Yeah.
maybe you can write the message on the mask. It's like, no flu shot.
No,
Yeah.
they are actually having the hospital, the overheads in the hospital are telling them, you're not allowed to tell people. They don't want they don't want patients knowing that the reason you're wearing a mask is because you declined a flu shot. So if most of us in our camp know that, we see it, we actually will hunt out a nurse maybe that has a mask.
Yeah.
But for other people that don't know, they just think, oh, my healthcare provider is maybe sick or something. And then the person just has to say, oh, I'm just being safe, even though they're not just being safe, they're being forced, to get a flu shot at their work. So it's unfortunate. That's
But
the reality.
this is also possibly like a opening up a broader conversation of like the hallmark of Western medicine. Like the beginning of Western medicine is like you're born like with the original sin of being a germ carrier, and you vaccinate against it, and that starts the thought process that there's an illness, then give me a pill, or that people with white coats and stethoscopes have the answers, right? So if you're saying you're threatening the underpinnings of Western medicine when you're refusing vaccines, is that there's a problem that they have a cure for it. So I think that they don't want that discussion being held, like, means, and again, I'm not even saying that there's not some merit to that argument that they're making, but it is threatening. I think the questions of vaccine safety threatens Western medicine, and that's why the pushback is so hard.
Yeah, that's for sure. Now, what about those that are denied access to bonuses or promotions and that type of thing? Could they possibly have a complaint?
Yeah, if you can prove it, but I think they'll be pretty. I think those things will be subtle. How do you know why you didn't get a promotion or a bonus? Like if your supervisors make it clear and you have evidence of it, you have recording, you have evidence, like, sure. But I think those kinds of discrimination will be more subtle.
Okay. Are bills like our bill HB 193 still going to be important, or do you think potentially the new division rules would make them unnecessary?
Extremely important. And because federal government administrations come and go.
Yeah.
So your state law is extraordinarily important. And the perfect example, the current one, is the Trump administration came in and is looking to dismantle Obamacare to the extent they can. So if an administration following the Trump decides to change these HHS proposed rules, if they go through, then you want the state law. So full steam ahead on the state law.
Yeah. Okay, good. Last year, the Ohio Department of Jobs and Family Services made a new appendix to a rule allowing private schools, private preschools, daycare providers to simply not enroll in vaccinated children. This seems our state exemption law should prevent them from being able to do this, but a review by the Legislative Service Commission determined that the state law, quote unquote, did not cover enrollment. So what happens when state agencies that are receiving federal child care funds are making rules against existing state exemptions?
Yeah, I think, and again, this is another gray area that I hope these HHS rules go through. But right now, the HHS rules, I'm going to get back to the daycares, but if these go through, it's very specific for like adult healthcare workers. They have, and when they listed all the places where it's posted, it doesn't say K through 12 schools. It doesn't have to be in school nurse's office. It doesn't have to be in daycare. So that's not in the rules, right? But that's not HHS's domain, right? That's more Department of Education. So I think that there is a civil right to K through 12. Like, you have a right to K through 12. You don't have, it's not like a statutory right to daycare. So where it gets murky, because you don't have a right to go, but you also, if the new rules coming out of Washington are you can't discriminate against people on religious grounds if you receive federal funds, then all the daycares that receive federal funds, they'll go with that tide. I think that's the way it should play out.
Yeah.
And I hope what happens with these HHS rules go through, it applies to healthcare, then it moves to K through 12. and then everybody just gets the message. You know, if people submit religious exemptions, or if a medical procedure is against their religious beliefs, that they don't have to do it. If that's the new theme regarding healthcare, I think it will that it'll catch on everywhere. Almost in the sense now that the school nurse now is everyone needs to be vaccinated for everything all the time, right? That's the attitude coming out of the school nurse.
Yeah.
So if that will change, it'll be let's have a nice meeting, let's have a big conference call every school nurse and say you're no longer pharma sales reps, right? You are now people who respect religious freedom. Okay, meeting's over. Right? It's a 30-second meeting, but if it's you respect religious exemptions from now going forward, or you lose federal funding. That's the broad strokes, but that's the kind of broad stroke we want. That would be a pushback to Healthy People 2020, right?
Right.
Healthy
And
people.
everybody speaks money, so that will be heard loud and clear. If you think you're getting a budget cut, all of a sudden you're going to be on board.
Right. But again, none of that's happened yet, right? Like, and even if these proposed rules go through, who knows how long it'll take to feel the pain? Like, will HHS really not reimburse, and when will that be? 2019, 2020, 2028? You know, like it hasn't happened yet, and I think people, just human nature, you know, they know the stove is hot, but until they touch it, you know, they don't necessarily react to it.
Yeah, that's very true. One example we considered was grant awardees, like the American Academy of Pediatrics and its state chapters, who receive funding through various HH grants while actively pursuing the removal of all non-medical exemptions in state legislatures. This happened to us in Ohio during the budget meetings this year. What would be the implications for lobbying that directly counters conscience and religious freedom, or is there?
Yeah, no, I think that is a great question. That's my favorite question that you had, and because I hadn't thought about it before that, and I think there's freedom of speech issues there. You know, like they can theoretically lobby for whatever they think is right. You know, just like our side does. But
with slightly less funds, Kevin.
Yeah. You know, but again, that would be coming out of, you know, that would be like if you were named HHS director, that would be a rule, right? But we don't, we don't know to what extent or how far they're going to go into this. To me, that would be pretty far. That would be pretty far down the road to go in and say, AAP, you can't say what you think, right? So, but they can say what they think. As long, to me, I think this is the way it should be. Everyone can say what they think. But if someone has a religious exemption, religious feeling against it, that's the end of the debate. You know.
Yeah. I'm fine with freedom of speech, but I don't like you know, AAP coming in and trying to ram stuff through our budget.
Yeah. Right, but I think people
go about it the right way.
I think people are onto that. I think people. I think you know, like you know, it's the internet age. You know, like wherever you get your information, you know, consider the source, right? And it's not it doesn't take too many clicks on AAP's website to see where they get their funding.
Yeah, not too many.
Yeah.
Well, Kevin, thank you so much for taking the time to weigh in on these pressing questions. Again, I hope everybody will check back with us next week as OAMF brings you part 2 of our interview with Kevin Berry regarding the changes at HHS. Thanks so much for watching.
Thank you.